Medical College. Then he did his orientation teacher training program from HTH Kolkata. Then he did the PG homeopathy from Hahnemann College of London. Then he did diploma from the International Academy of Classical Homeopathy. Then he mastered in CCAH. He stood second in CCAH, which is from the MUHS Nashik. Then he did the FCAH fellowship course from MUHS. So these are the various degrees or the achievements by Dr. Karia sir. We just doing our MD and or BHMS. I'm only a BHMS. But what we want to achieve something like this. This is the inspirational and idol of Dr. Rajiv Karia sir. I personally and from Unity Multi Speciality Homeopathic Clinic, I welcome Dr. Rajiv Karia sir, and I'm very grateful and towards him that he from we have a very small talk that can you able to do a webinar, sir? So she said yes, why not? So this is the humble personality he has, and because of all these things we get into his touch, and we know the things. We attended one seminar of Mother Nature last month in the March. That was a very excellent one. I personally has a very short notes on all these and go through it daily. That what we have missed in that Indian drugs. Thank you so much, sir. Uh, please continue. I gave it to Mike to you.
Thank you so much. Very nice introduction. I'm very thankful to Unity Hospital for inviting me on this webinar. And I'll try my level best to share what I know about chronic miasm. So let's start with aim and objective. What would be the main aim and objective of this session? The aim and objective of the session is to establish role of old books in understanding miasm. Then clinical understanding of my own cases of nosode in relation with miasmatic understanding. Then understanding in a pictorial view of the case. For example, if a patient of lachesis who has the palmistry of left-sided heart line is not there. So I'll teach you to read palmistry also, because palmistry also comes in the understanding of miasm. This is my clinical research since almost 25 years, where I always see the palm of the patient where are hot, cold, or the lines of the palms, which are really understanding of the miasm. How you have to see the miasm, I'll show you the way out. Next is to establish the trilogy of homeopathy under the pretext of the miasm. And understanding of Bhagavad Gita, but this topic I will not take now because it is a very vast subject, Bhagavad Gita, in context with three gunas. Three gunas are very important when you understand Rasic, Sattvic, and Tamogudi. These three mimics our Sora, Psychosis, Syphilis. The trio of the gunas and trio of miasms. So
Thank you, bhai.
Hello.
Thank you.
Hello. So trilogy is Materia Medica, Organon, and Repertory. So I'll be speaking on Materia Medica, Organon, and Repertory. The books. Books are the real understanding of the miasms. The old book, which is very much neglected, which I have selected today, is of Sir J.H. Allen's original work on the chronic miasm. It is an original work. This is compilation of two separate volumes of Sir J.H. Allen's original work on the chronic miasms, enlisting useful case reference with detailed explanation of the miasm. Now, this is very important book. as a clinical practice where you have to know the role of miasms in understanding the case evolution. We have to understand how the case has been evolved. The evolution of the case is very important. Understanding that you will get from this book, the book original work. Now, Professor J, that is John Henry Allen, MD, from 1854 to 1925. He lived on this earth and he was born in 1854 to 1925. The Professor J. Henry Allen, MD, Professor of Dermatology. Please remember, he was Professor of Dermatology and Venereal Disease at Herring Medical College in Chicago, Illinois, people of H.C. Allen. Now, he was a student of H.C. Allen who wrote Allen's Keynote. Main publication, Sora and Pseudosora. He is the father of Pseudosora, you can say. Then psychosis, he wrote about second volume of psychosis and disease and therapeutic of the skin, dedicated to Professor Henry C. Allen. So he dedicated to his guru H.C. Allen. Dr. Henry Allen was a student of H.C. Allen. He was a president of IHA in 1900. Dr. Allen taught at the Herring Medical College in Chicago. Dr. Allen died on 1st of August 1925. Book by Dr. J.H. Allen, Disease and Therapeutic of Skin, 1902, The Chronic Miasm, Pseudosora and Sora in 1908, The Chronic Miasm, Psychosis, 1908. There is a third volume which has not been published, is of syphilis, but syphilis was not published. And it was very good book, but not came to the world about syphilis. He wrote many things about the syphilis also. So let us start with understanding of this book and the first page. The first page says, as our institution are, so our people. So it was this like thoughts which prompted the author to write this book. The younger man of our profession stand greatly in need of such a work. So nowadays, this kind of work is needed. They must become acquainted with Hahnemann's teaching and percept, so wonderfully laid down in the organ of medicine. I remember about the Herring lesser writing in the fourth chapter of Kant's lesser writing. He wrote about aphorism and percept. So you go home and read Kant's lesser writing about this. So busy practitioner has no time and perhaps no one to help him to work on the vital problem given to us by great teacher Dr. Hahnemann. Like many other waited for this work, hoping that it might be some degree meet the demand, if not approval of the profession. This is very important slide of Dr. J.H. Allen. Now I'll take you to the index of the volume of J.H. Allen book, where he states about he has written in alphabetical order: abdomen, bacteria in relation to pathology, basic science of Sora, bowel, intestinal tract, cavity of mouth and teeth, chest, heart, and his closing remark. Desire and aversion. We see always in our practice, many patients have desire and aversions. So disease state, we have to read this chapter in detail. So I have taken some glimpses of this chapter. Ears and hearing, eyes and vision and face, idiosyncrasy. This topic of idiosyncrasies is nicely written in J.H. Allen book. Mental sphere, miasm and relation to abnormal growth. Now this chapter is very important. Miasm and abnormal growth. Miasm suppression and miasm relation to pathology. It is in the page 51 to 73. This is the book. Let me show you the book. This is the book. Very nice book. Read. It's almost 2-3 years I'm reading this book. So exhaustive book and has to be read several times. This book has to be read several times to know the real understanding of miasm. So miasm way in which the suppression takes place. Nose, smell, predisposition is excellent chapter given by Dr. J.H.L. Sora and its rubric. Scrofula. Scrofula is also a part of miasm, where the patient has glandular tendency. Suppression of miasm. Upper extremities, lower extremities, urinary organ. Then I'll start with volume 2 of chronic miasm by Dr. J.H.L., which is a psychosis. He is the author of Disease and Therapeutic of the Skin, professor of Disease of the Skin and Miasmatic Herring College, volume 2, written in Chicago. The first Indian edition, Search Until You Find the Secret of Disease. See what he has written. It was printed by Roy and Company, Princess Street, Mumbai in 1950. Almost many years from 76 years back. Second volume, which is to follow soon, will give you the full exhaustive description of the action of malignant miasm, the complication of primary, secondary, and tertiary stages. Then the therapeutics of dysmenorrhea. My friend from Pune, Dr. Ankur Patel, was telling about dictamus. Now, dictamus is given very well in J.H. Allen book. Dictamus is a nice medicine for leukorrhea. It is given in this book. So if you have a problem in understanding leukorrhea cases, please go through therapeutics of leukorrhea in this book. Now, what is being given in this book? To that devoted band of physicians native of India and graduate of Herring College, who has spread the benefit truth of homeopathy among the therapeutically benighted. Benighted means ignorant persons. Billions of natives country work on miasmatic disease dedicated with best wishes for their success by the author. Now, preface to volume 2. Volume 2 has psychosis. The psychosis symptom presented in a different stage of disease as carefully observed, many times verified. Now, this sentence is very important. Many times verified. So that we feel quite confident that we'll endure the test of further investigation. For understanding of psychotic phenomena, for example, I'll like to share about the anemia cases that you see in CKD, chronic kidney disease. This is the manifestation of psychosis. So when you see in the blood report, chronic anemia, it is a sign of psychosis. In the writing of therapeutic book, we have given indication of each remedy in brief, and therapeutic index is also being given by this author. Now, what is you will get in volume 2? Volume 2 will get complication of psychosis, cough of psychosis, very important chapter. It has in the page 59 to 60 in psychosis chapter. So therapeutic of gonorrhea, materia medica of urinary tract, dysmenorrhea, leukorrhea, and this is very important chapter. Please take a screenshot of this slide because it is very important slide. Now, what he writes in the psychosis. For every earnest and thoughtful physician must have seen during the long practice, sometimes the disease encounter is difficult to eradicate. Very important. It is difficult to eradicate. Something lying as a basic makes disease stubborn, persistent and positive in nature, difficult to cure. It is given in the page 9. Please read this on page 9. It was Dr. Charles Hempel who said, disease is the totality of the effect of which we recognize or perceive the action of the peculiar order of subversive forces upon organism, which has adapted or prepared for their reception. Page 10. This is also important slide where we are to know the understanding of psychosis. Psychosis as potent than syphilis. Now this is our world is moving towards psychosyphilis destruction. You can see a lot of destruction which is going on. Mania, insanity, and other mental aberration can be traced to the suppression of this miasm psychosis. In fact, our jails and our prisons are filled with poor unfortunate, far outnumbering the victims of syphilis. Psychosis is more potent than syphilis as the cause of mental disease. If you read mental disease about Veratrum Alvin Kent. So next topic would be my Kent's lecture and Kent's lesser writings, where I'll show you what Master Kent has said about different remedies and the 4 parts of Kent's lesser writing. This will be my next topic. Moral insanity and degenerative changes process is the basis of criminality of our country as well as the Europe. Page 16. This page is really an eye-opener for me when I read about psychosis. Now, psychosis in women. This is very important in women cases. Generally, this miasm psychosis distributed among adult males, around 80% are affected. Estimate includes latent as well as active form. Latent as well as active form. Pelvic affection, rheumatism, and chronic gout are outprocessing the hereditary miasm, congenital as syphilis and soda. Can be studied from the page 17 of the volume 2 of psychosis. Children suffer often 1 to 3 months after birth with colic. You may have encountered in a practice where the children suffers from colic. So this is hereditary part of the psychosis miasm. So children born of such parents show some form of disease like ophthalmia neonatal. If they escape from the dreaded disease, they suffer from colic almost from the moment of birth. So there are remedies for that, and I'll tell you in further slides. The first psychotic colic is lycopodium and argentum nitricum. The pain comes in paroxysm in spasmodic nature, relieved by pressure by child lying up on the abdomen or being carried above. Now this heat gives temporary relief, but all food greatly aggravated, even the mother's milk. Gas is frequently expelled from the stomach or bowel with great force. These are all psychotic colic. Please, dear student, remember where lycopodium and argentums are required. Many times I relieve these little sufferers with few powders of lycopodium or argentum nitricum. Both remedies seem to frequently called, and it is written in the page 18. So go home and read this page 18. This is very important slide where you will solve many of your psychotic cases with lycopodium and argentum nitricum. Now what he writes about the snuffles. Snuffles are very important. Mother or nurse will tell you that child has taken cold in the head so closely that disease resembles ordinary coryza. Nasal places specific form of rhinitis known as snuffles. Nose is dried, stuffed up, frequently child scream, and you will get such kind of cases in your practice. So the child is unable to breathe from the mouth. So he has to breathe from the mouth, cannot breathe from the nose. So there is history of parents which reveals psychosis. So to rule out this psychosis, we have to go into the past history and family history of the parents. I have sometimes noticed that the case of snuffles coming as soon after the birth would follow by the case of purulent ophthalmia. This is the clinical confirmation given by Dr. J.H.L. Now, the stools of chamomilla, rheum, and mecca. These are all information given by Dr. J.H.L. The time to cure infancy or during childhood quickly responds by chamomilla, rheum, and mecca are the characteristic of psychosis too. I have noticed in number of cases children born of very psychotic parents, complicated with gout, were affected with gouty constitution, urethra, ear, nose, and even in the rectum and vagina. This child takes cold at the slightest exposure, frequently suffers from acute coryza, discharge from the nose become copious and watery, often excoriating. This is very important. Excoriating. So this is information given in J.H. Allen book. The potency means power. Page 20, volume 2, psychosis. If the snuffle should suddenly leave, great base case of colic develop can inform the impatient parents that baby suffers from this snuffles or psychosis part. If you easily do this, if you study little over our Matra Medica, give enough high potency. So now Dr. J.H. Allen advised us to go for higher potency. Yesterday, I had a case of Medorandum where I could prescribe CM power of Medorandum. When I read this book, it is an inspiration book which gives us courage to prescribe high and higher potencies. It will take highest. You have to cure sometimes in a deep-seated disease. Remember that potency means power. This is very, very important. Very, very important line from J.H. Allen Psychosis. Please take a screenshot. This very important slide. Now, deep chronic disease. No power curative outside the potency with which no cure is established. The right remedy requires and will require a close study of proving. So provings has to be studied in detail. I like to share something about provings. So when we are reading proving, when you get in the later proving, what Dr. Herring said, these are very important. For example, if you open Allen Encyclopedia and the patient is giving a proving symptom after 10 days or 15 days, that becomes very important for our clinical understanding, which has been seen by Dr. Herring and monitored or confirmed by Bonninghausen. And this information I got from very nice book by Dr. Sarabhai Kapadia. Very nice book. I'll show you this book also. You will get 10 times more prompt action in deep chronic from CM. Then you will form the lower one. See this, what is this? This is very important sentence of this book. In the acute case will work, many of them anywhere tincture upwards. Yes, in many times stopped complete modified severe pain, neuralgia, and this nowadays you see a lot of neuralgia and rheumatism. 3 to 6 minutes, 100,000 potency. Matlab in short, this chronic disease needs higher potency. Power or potency. You limit your own power when you limit the power of potency. You believe God is infinite in all things. Do you not? Well, then prove him and see for yourself. Is this not true? Now, what a sentence it is by Dr. J.H. Allen. I like to read it once again. You limit your power when you limit the power of potency. You believe God is infinite in all things. Do you not? Well, then prove him and see that, and see for yourself it is not so true. Page 21 of JHL. Now psychosis. Pains and aches. Nowadays you will see in lot many cases. and that are the mastermind psychosis. You need psychotic remedies, which I will be talking in later part of the session. So serious illness like pelvic pain, neuralgia, rheumatism, chronic backache, chronic bladder pains, uterine, ovarian troubles, headache, neuralgias. These are all psychotic illness. Now, what are the tertiary stages of psychosis? Truth is that she never being well since the birth of her child. Now, never since the birth of child is very important of tertiary stage of psychosis. Whole case is the history of pain and suffering due to primary infection. This is where the is looking at the symptom of primary and secondary. Now pass to the tertiary. How the tertiary stage comes when you remove the uterus from the lady at the age of 40. Now I'll give you a case of from JHLN book. So please understand, please focus on this case. It is a case of Miss F, age 24, German by birth, well developed physically, bright intellectually, sunny disposition, married 3 years, no children, was pregnant 18 months after the marriage, but aborted at the 3rd month. Her treatment was curement, after which she was confined to her bed for 3 months. She was unable to look after her household duties ever since. On examination of pelvic content, the uterus found to be very much hypertrophic and extremely sensitive to touch. She complained of shooting pain in ovaries through uterus, bearing down continuously pelvic region. She fainted spells, has a fainting spells during the menses. Much trouble with her heart. Although examination seems normal, scanty, musty smelling leukorrhea and pruritus were there. I decided at once, previous and present history of the case, that she was infected with psychosis and told her husband would also require treatment in order to make perfect cure. Now, this is very important. Where you see history of infection ruled out the husband history also. Pain in the stomach after eating, a dull, heavy character accompanied fear of death, and you have to clap within the last 5 years. And she has a terrible headache. The headache treatment was Nux Omega CM for the first week for gastric complaint, but it did not cover her mental symptom. She did not receive any benefit from the remedy. Now the next remedy which was prescribed in CM, Medoranum CM, and which caused the discharge to return and completely cure followed. Now this is example of a case where you will see the result of antipsychotic remedy. Now understanding of mixed miasm. Now mixed miasm are very difficult to cure. How to cure? You will get this answer. History of good health in the wife before marriage, then sudden decline. So when there was a history of good health in the wife before marriage, then sudden decline in the health in a known tubercular patient, pretty positive sign of psychotic infection, especially where pelvic symptoms are present. Psychosis is suppressed in pseudosoric or tubercular patient. Now this is very important, where a psychosis is suppressed in pseudosoric. Okay, miasmatic union is difficult to separate. Matlab, when there are different miasm coming at the same time, it is a law that all force push direction of little resistance. Constitutional predisposition of the patient, whether tubercular, syphilitic, or soric, whatever degree, perversion met with. Now, understanding of mixed miasm, where to treat the surface miasm. Many cases I have noted that acute articular rheumatism and chronic are the tertiary stage of psychosis, take on gouty nature. Many psychotic affected patients Attack with appendicitis. If the patient happens to implant on the organ tubercular trend, assume malignant type. Now the second case of young man. A case of a young man with 8 months previous to his death was strongly healthy. No finer physic or better specimen of the health. Faint history of tuberculosis in the family. So it is very important to know the family history of tuberculosis. Organ was removed. Within 60 days, there was infiltration in the light lung with fever and cough. And little later, the malignant symptom of phthisis developed. So when there is a suppression, so there is history of suppressed psychosis. So tubercular and psychosis. Anemia is the first change of psychosis. This is the most important slide where you will know the patient is suffering for suppressed psychosis. First change which psychosis produce when suppressed is to attack the blood to produce anemic state in the condition. Example in Bright disease. Bright disease is chronic kidney disease. Anemia becomes basis of deep destructive disease as cancer of the breast, uterus epithelioma, diabetes, Bright disease, phthisis and pneumonia. This page is very important in JHL. Now important of my miasm. How necessary for us to know what miasm lies behind and to cure made under the right anti-miasmatic remedy is found. Remedy covers febrile totality. Look into the mysteries of miasm. Find out SORA, psychosis, and syphilis. Very important. Case of severe muscle pain. A man came to me long suffering from severe backache, worse at night, rust in different potencies. Even rust, radicans, mercury, and arsenic were given. He was clinic patient, lacked necessary time to look carefully into the case. I looked into the case, examined carefully. He had syphilis, and which was cured. His body covered with scar and tiny spot of syphilitis scoma. Syphilinum CM was given, which cured the pain. Very important. Which the pain. This is very important where you get the history, the syphilis miasm. How necessary is to become acquainted with nature and action of chronic miasm. Now I'll take you the aphorism for miasm. What are the aphorisms that you'll see in miasm? Reference to the miasm of 6th edition of Organon, aphorism 5, aphorism 72, 76, 74 to 76, 78 to 82, 103, 204, 206, and 227. Then I'll take you to the short notes of miasm. So this is most important slide of the webinar session. The SORA has onset sudden, psychosis slow, tubercular erratic, and onset of syphilis is very fast. Please take screenshot of this slide. Pace is fast in SORA, slow in psychosis, slow in tubercular, moderate in syphilis. Speed is rapid, sluggish in psychosis, rapid in tubercular, moderate to fast in syphilis. Intensity is marked, fair in psychosis, heightened in tubercular, marked in syphilitic. Pattern is periodical, slow in psychosis, erratic in tubercular, fair in syphilis. Frequency is regular, frequency is slow in psychosis, frequency is irregular, frequency is fast, sensitivity is increased, sensitivity decrease, sensitivity is marked, sensitivity is less. Reactivity increased, dullness is seen in psychosis, heightened in tubercular, moderate to fast in syphilis. Process involve acute, chronic, and fulminant. Susceptibility high in SORA, moderate in psychotic, high in tubercular, low in syphilis. Depth and pathology, superficial, functional, marked and overgrowth, deep and destructive, well marked and irreversible. Now the next book. Now this book is very important for skin complaint. In your practice, if you read this book, you will get answers to many problems. Remove the cause of this effect. For this effect, defective comes by the cause. I dedicate this little work to one and whom I only indebt to my recovery of severe illness, impossible to me, who was one of the first aroused in the importance of following Hahnemann principle, who was been ever one of the most ardent Nux Vomica in Kent repertory. Ardent rubric you will see in Kent's repertory. Faithful followers of true homeopathy. Wise counsels shown in laws of similar. This is introduction given by JHL. This is the content of JHLN skin book. Now this book is divided into general anatomy, then classification. Now if you read classification in JHLN skin book, inflammation, hemorrhage, hypertrophy, atrophies, new growth, neurosis, disease of expression, and parasites. These are very important topics of GHLN skin therapeutics. Now, what is classification of parasite vegetable pet in tinea? This tinea is, I'll give an example of many cases who suffer from tinea. So in one of the tuberculinum, Burnett says the fungus is only the guest of the disease, worse undressing and after bathing. This you will see in many of your cases of tuberculosis. Sorinum intense eating relieved by scratching. This is also a very important slide which I have taken from the book Therapeutic of Skin. Gems and gems have been given in the Therapeutic of book by GHLN skin book. Now repertory. Now repertory representation of miasm. Sora, there are 222 remedies given in Adonis. In the software Adonis, if you open software, there are 222 are you able to see the skin? So if you go to the repertory, if you type Sora, there are 222 psoric remedies. Are you able to see the slide of Adonis repertory?
Yes, sir.
Okay. So when you are taking a case of Sora cases, there are 222 remedies given in Adonis repertory. Now in psychosis, in Adonis, you will be able to see almost 192, 195 cases of psychosis. So let's go to psychosis. So psychosis, we have 195 cases. Remedies, are you able to see?
Yes, sir.
So there are 195 remedies of psychosis. Now this rubric is very important. Chronic psychosis. Gonotoxin, influenzinum, medoranum, thuja and vaccine. Suppressed psychosis, mercury, nitric acid, staphysagree and thuja. See, mercury is antisyphilitics. So when you suppress this psychosis, this goes into syphilis.
Sir, I had a doubt. We can
Can
take
we
it at end or can I ask,
can
sir?
we put it in the end? Because I have to show almost 100 slides.
Sure, sir. Sure.
100, more than 100 slides. We'll put it in the end. Please mute ourselves, please. In syphilis, we have 219 syphilitic remedies. So when you are in doubt, just refer this agonist and you will get 219 remedies. ये स्लाइड विजिबल है क्या? दिख रहा है थोड़ा?
Yes, sir. Yes.
Yes,
sir. Yes, sir.
yes, sir. है syphilis की नहीं.
Syphilis accompanied by emaciation, exhaustosis, fever, pain at night, salivation, glands, case of hair falling, nails swollen at root, tongue
सर
swelling.
स्लाइड नहीं दिख रही है.
No,
Repeat
syphilis
करा
slide,
सर.
sir.
Syphilitic की slide
Sir,
sir
change
please
the slide.
दिखाइए.
Change the slide to psychosis to syphilis, sir.
Okay.
Yes, yes.
See, 219 remedies are given in syphilis. Arsenic iode, aurum mure, aurum mure naturatum, Kali iode, wonderful remedy as an anti-syphilitic. If you read Kent's lecture, which I'll take you to the next session also, where I'll talk very much detail about Kali iode, where Dr. Sarkar uses this Kali iode in many anti-syphilitic cases. These are the anti-syphilitic remedies. Now this is very important. Latent secondary symptoms of miasm. Slide दिख रही है सबको? Good. Now please keep an attention to this slide because this is one of the most important slide and it took almost many months to prepare. Few latent secondary symptom of miasm. Sora chili, case due to suppression of skin eruption, natural discharge, sweat, stool, urine, and menses. Psychosis. Psychosis cases have greasy, shiny, indurated, thick skin. Linear is syphilis, symmetrical, sepia, syphilinum, and thyroidinum. I'll show you many cases of thyroidinum treated with many manifestations. Pseudosoric or psychosoris, marked sweating, usually hot sweating. This is the most important slide for me because this will teach you the entry point of psychosis, sora, syphilis, pseudosoric, psychosoric. This is very important slide. Now, what are the mind and intellect of soric? Attacks of vertigo. You'll see many cases will complain of vertigo, diarrhea, faintness when meeting to strangers, unusual ordeals, for example, gelsemia, fear of death, fear of being ill, fear of being alone, fear of dark, fear of night. You will see in syphilis as in mercury and syphilis. Psychosis, jealousy, apis, hyosamus, lachesis, fixed ideas. Syphilis, reasoning power is very slow also in psychosis. but there is a lot of weakness in memory you will see in syphilis. Pseudosora or psychosoric, very changeable, change of place, job, partners, easily exhausted. This you will see in basilinum. I will show you many cases of basilinum treated with this mind mentality. Now what you will get in head? In Sora, frontal headache or head, hairs are dry, heat of vertex. Very, very important of soric cases. Also in pseudosora, psychosis, vertex, frontal headache, soric, psychosis, vertex. Hairs are thick, alopecia areata, prematurely graying hairs. There you will see the thyroidinum. Excellent work in thyroidinum cases. Coldness of vertex you will see in calcarea carp and sepia cases. Syphilis, occipital, very important. Occipital baldness you will see in graphitis cases. I will show you many graphitis cases in my next slides. Hair falling from occiput, patchy alopecia, alopecia diffusa, very important. Head, pseudosora, psychosora, temporal affection. See, temporal affection, very important. Temporal affection, occipital affection, vertex is psychosis, and frontal is soric. समझ में आ रहा है? This is very, very important. Where you will pick up the miasm. Sora, frontal, psychosis, vertex, syphilis, occipital. Pseudosora or psychosora is temporal. Like you will get it from in cases of natrum youth. Then comes ear. Now this soric patient are oversensitive to sound. Dry, scaly, itching in the external ears. Very, very important. Soric symptom. This is the soric symptom of many cases. Now frequent boring in ears you will see in sorinum, sina and natrum carp. Ear psychosis. Excess of hair on pinna, that is thuja. Vati growth, polyp on external ears, excess cerumen. This excess of hair on pinna is thuja. Syphilis, acquired sensory deafness. This is very important. Congenital deafness, deaf and dumb. Pseudosora, recurrent boils like mercury picric acid. Middle ear infection in ear cases. These are all tertiary stages of miasm. Now, Sora, hypersensitive to smell of flowers, perfume, cooking. Many patients they will tell you, कोई भी perfume लगाता है हमको अच्छा नहीं लगता है. This is pseudosora or syphilitic expression. Red swell knobby nose. You will see in aurum, borax, calioid, rustox, thuja. Now this nasal turbinate hypertrophy. This is the indication of thyroidinum cases. I'll show you in thyroidinum cases. Snuffles you will see in psychosis with clinker formation, destruction of nasal bone and DNS. These are the cases you will see in Kali bichromicum. Pseudosora nose, recurrent catch cold epistaxis which relieve the most of the complaint. Example, TUB, tuberculinum. Now comes eyes. In Sora, photophobia from sunlight. Artificial light is tuberculinum and syphilinum. Please understand or underline or take a screenshot of very important slide where you have to differentiate between a soric and tubercular and syphilis. Now yellow sclera in psychosis. Yellow sclera you will get in Kali bichromicum cases. Kali bichromicum cases. Kali bichromicum cases as yellow sclera. In blue sclera you will see in calcarea calf cases. Calcarea calf as blue sclera, superficial corneal ulcer. Please remember this sclera. This, when you see a sclera of a patient, you will enter into the miasm of the case. Syphilis, deep corneal ulcer, pseudosora or psychosora, pitted spot in the eye seen in psychosora, purulent conjunctivitis value discharge, psychosora. This is very important slide again. Blue sclera you will see in calcarea calf cases. Yellow sclera you will see in Kali-Calf cases. Yellow sclera in Kali-Calf cases. Then comes face. Sora, pale face with red lip, arsenic, sulfur, basilinum, and osmum can. Dr. Sarkar's understanding. Psychosis, greasy, shiny appearance, thick eyebrows, hair on unusual parts, and if more on unusual part is medorrhinum. So, medorrhinum. Syphilis on the face, falling of hair from the eyebrows, very important. Eyelashes. Eyelashes and eyebrow, we have selenium cases. Beard in psychosis, congenital deformities like squint and cleft lip in mercury. Inverted shape face, very important. This also in thyroidinum cases. Inverted shape, pyramid shape, thyroidinum and calcarea fos cases. Circumcised red spot on cheek, these fissure on lips, ammonium carb, pipersulf, natramure and pulsatilla. Then gastrointestinal, perverted, burnt taste in mouth, bad taste in the mouth, craving for sweet, sleepy after eating, nux vomica, sleepy after eating, eating cause pain in abdomen, psychosis. There we have seen lycopodium and argentum nitricum. Constipation with hard stool, plenty of cases you will get. When the nux vomica, when lycopodium in soric,
कल
so
करी थी मैंने खाना खा रहा था मैं भी फोन भी नहीं कर रहा
soric lycopodium. When the patient is in soric form of in lycopodium, morning diarrhea, desire for sour things, sora, acid, fatty food, diarrhea is changeable, constipation with ineffectual urging to pass stool. This is also important slide of gastrointestinal effect of psychosis and sora. Gastrointestinal effect of syphilis, profuse salivation, deep cracked on tongue, flabby, glossy, shiny tongue, complete loss of taste. This is important. Complete loss of taste. Aversion to meat, desire for cold things. Very, very important. Many belladonna cases you will get where the belladonna is in syphilitic state. Belladonna, syphilis stage. Hereditary tendency to alcoholism. Pseudosora, desire for salt. My God. Many natramure cases. Many natramure and tuberculum cases. They will have salt in their plate, fatty fluid, digestible things like chalk, pencil, worm infestation, where you will get serenum, screenum, IBS, craving for meat and fish and sinus, multimiasmatic, leukopenia. My God, so many cases you will get of leukopenia. Malignancy, ulcer or crack on the margin of tongue. Urinary, increased frequent urination with polyuria, slight burning, which relieves after involuntary micturition while coughing. 100 of ladies' case will have this. Hundreds and hundreds. Sneezing, laughing, you will see in causticum Natramure, pulsatilla, and silica cases. You can even add thyroidinum. When thyroidinum is in soric state, thyroidinum cases. Very offensive urine, benign prostatic hypertrophy, where you will get digitalis. Digitalis. Proteinuria is pseudosoric. Polyuria at night, pseudosora. Polyuria in day is psychosis. Polyuria at night is syphilis, and even you will get in medorinum cases. Marked prostration after micturition. Involvement of parenchyma is strong syphilitic feature. Please underline this part. Very, very important. Very, 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 very important. Polyuria, offensive urine in pseudosora and psychosora. Recurrent UTI gram positive, gram negative in psychosis and psychosoric cases. Glomerular nephritis with different cast and RBCs. Believe me, dear student, this is one of the most important slides according to me. Multimiasmatic is malignant disease, small contracted, polycystic. Cystic is very syphilitic. Syphilitic expression. Cystic kidneys are syphilitic expression. Then comes genital organ. Menses too short and too prolonged with non-offensive leukorrhea. Profuse offensive seen in sepia in psychotic cases. Spasmodic dysmenorrhea, psychosis. Membranous dysmenorrhea, syphilis. Said during menses, pseudosora. This is also very important slide of miasm in affection on genital organ. Then comes sora in extremities. Burning palms and soles, very important. Gouty deposits in the joint, psychosis. Pain worse by heat. Very thin nails, mercury and syphilis, very thin nail. So mercury and syphilis has very thin nails. Drop things due to incoordination, pseudosora, cyni, tubercular, chilblain, muscular dystrophy, mixed miasm. These are all mixed miasm. Paralysis, mixed miasm. Plenty of cases you will see of mixed miasm. Skin, dry wart, plain warts, anacardium and natramure. Skin is greasy, oily in psychosis. Also in syphilis, but plumbum and sorinum. Tendency to scar and keloid formation, my God. You will solve many cases with this understanding of keloids because keloids are very difficult to treat. Now this spider nevi is multimiasmatic. Slightless injury suppurates, varicose vein. Plenty of cases you will get of varicose vein. Varicose ulcer is syphilis. Multimiasmatic. This is very important slide of multimiasmatic skin. Psoriasis, pemphigus, xeroderma, epidermolysis, bullosa, ichthyosis of different size. Fishy skin is ichthyosis. Exfoliative dermatitis, mixed miasm, again. Respiratory, cough which is dry, soric. Childhood asthma, psychosis, barking cough, whooping cough, syphilis, where Drosera comes, Carbovec comes, CV and Drosera. Pseudosora, chest is tubercular. Worse at night, pseudosora. Now CVS, cardiac, very important slide it is. Soric patient with cardiac. Examine the pulse frequently. Regarding their heart, rarely die from cardiac disease. Heart trouble with reflex, rheumatic trouble, very important. Atherosclerotic, this pseudosoric. Syphilis, these are unaware of cardiac problem. Patient dies suddenly from cardiac without suffering. You will get after post-COVID, COVID-19. Rush of blood to the chest and the face. Difficulty in ascending motion. Digitalis. Also in psychosoric in calcarea cup. This is very important slide again in CVS. Now, my own few cases. So let's listen.
Sir, it is
आवाज
not
सुनाई दे रहा है आपको?
not audible.
Okay, I'll tell you. This man is saying that after taking your medicine, I have stopped taking alcoholism. I am seeing everyone taking alcohol, but I am not taking it. He used to take alcohol every third day. सर दुखता था वो भी आराम. मेरा मन उधर ही लगा रहता था. He used to get sleep while driving, and this was very serious and severe condition. ड्राइविंग में अभी नींद नहीं आती. So it is a case cured with one single dose of tuberculum in 200 potency, then giving 1 m in single dose. Now next case. This is also a case of alcoholism where patient used to get continuous nausea after continuous उपका, brush करे એટલે ઉપકા. One of my assistant student may have seen, and he is doing so fine with this understanding of miasm. So miasm is very important understanding. Bleeding from the gum has also stopped. He has also reduced taking alcohol. Now, this remedies in detail. My first remedy would be very important remedy. It is a request that you give full attention to what I am saying now. If you concentrate on this slide, you will solve almost hundreds and hundreds of cases of this particular remedy. The remedy is basilinum. The basilinum is dominant psychosoric remedy. The patients of basilinums are hot patients with tendency to catch cold. Tuberculinum is chilly. Bacillinum has aggravation at night and early morning. Please remember aggravation at night, early morning. Present with a complaint of ringworm, pityriasis, and past history of suppression. Dr. AGD. AGD was doctor, allopathic doctor. He was riding in a carriage and he fell down. Fell down. And the injury was not recovering. So he wrote letter to Dr. Honeyman. Honeyman replied, have you suppressed your skin complaint? He said yes. Honeyman gave antisoric. And he was cured. This history is written by Dr. Richard Hale. Book by life and work of Honeyman. Now this shows that Dr. Honeyman had a deeper understanding of this miasm or antisoric miasm. So it is benefit to read this old author book. And this Dr. AJD was converted to homeopathy after this incident when he was cured by the known healing ulcer after falling from the carriage. Next comes alopecia areata. It is in the isolated spot. Physical dominant is tubercular is mental dominant. Bacillian patients are fatty, flabby constitution. Tubercular are mostly lean and thin, and emaciation, especially old people with mucopurulent expectoration. Till now, I think everything is clear for you. We are talking about bacillinum and the symptoms of bacillinum. Now the 8th point of bacillinum. Enlarged lymphatic gland, especially cervical. If you get this cervical enlarged gland, think of bacillinum. Think of also cystus gland. Bacillinum has infiltrative features more prominent and executive changes are seen in tuberculinum. Severe periodical headache with obstinate constipation. Obstinate constipation will get in leg defloratum. Till now, we have covered 10 points of bacillinum. Bacillinum cough has single paroxysm. Single. Bacillinum has warm and moist palm. Children are abrupt and harsh. Mind sphere. Teeth are draft. Bacillinum, Staphysagree, and Syphilinum. Teeth irregular. Bacillinum, acid floor, syphilis, and thuja. X-ray shows fluffy shadows. These are the signs of pneumonia. And bacillinum is indicated. Spina bifida is the symptom of bacillinum. These are the golden symptoms that you will see in botulinum cases. Now, understanding of miasm from palmistry. Now, if you see, there are major three lines. First is the lifeline, second is headline or the mind line, and this is the heart line. इतना क्लियर हो आप? palmistry में तीन लाइन होती है सबकी. Okay. Now in botulinum cases, mind line and lifeline origin gap is seen. If you see, थोड़ा enlarge कर रहा हूं मैं slide को. Are you able to see? Now, if you see these two gap, botulinum is mostly indicated. This is my clinical understanding. This is lifeline, this is mind line, this is heart line. If you have a gap between these two lines, the patients are obstinate, and these are the cases of botulinum. Now, this is the child hand of botulinum. उसको मैं enlarge करके बता रहा हूँ. See, are you able to see the gap between lifeline and the mind line or the head line? थोड़ा और enlarge करता हूँ. दिख रहा है आपको? कोई हाँ बोलो. ऑनलाइन ऑफलाइन?
Yes, sir. Yes, sir.
This is being treated cases of botulinum. This is my clinical palmistry, that suppose if you don't have any kind of symptom of botulinum, and if you are seeing this, just try it, but have all symptoms of botulinum. This is my clinical understanding. Now, botulinum cases, spina bifida. Botulinum is one of the remedy of spina bifida. Now, this single isolated alopecia areata spot on skull. Now, next remedy, calcareal carb, psychosoric. Calcareal carb are psychotic, psychosoric, pseudosoric cases. One of the best medicine to start the treatment of chronic case. Enlargement of lymph gland or lymphatic gland. Anterior triangle of the neck, very important. Anterior triangle of the neck. Case worse from cold, damp, better, dry, wet, while constipation. All discharges are especially sweat, stool, and saliva. This is important slide of all calcareal carb cases. Tendency to catch cold. Big head, open sutures with distended abdomen. Open sutures with distended abdomen. Open sutures you will also get in sepia. So I'll take you the sepia also. Difficult dentition. Before going to this symptom, I'd like to show you sepia from Borix Metra Medica. So let's go to sepia, 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 Boric. So open your Boric Metra Medica. Are you able to see open fontanelles?
Yes, sir.
See sepia, open fontanelles. Borix Metra Medica, sepia, open fontanelles. So in pediatric cases, think also of sepia in open fontanelles. Borix Metra Medica, sepia, head, fourth line. Head, fourth line. And you can see even pimples on forehead near hairs, similar to natrum muriaticum. This is clinical observations where the scholars have written. Let's come to the last symptom of calcareal carb. Difficult dentition, gap between the teeth, or history of delayed milestone. This is being confirmed in many calcarea carp cases. Many cases. See, you can see gap. See, this is the gap. In many calcarea carp cases, you will get. Now, in the next calcarea carp cases, this big large sweat drops you will see on the forehead of calcarea carp. Sure observation for calcarea carp case is a large drop of sweat on forehead. This is very important of calcarea carp. You should give in very high potency when you see such observation. Now, acute carrying angle, you will see in many calcarea carp cases. This is angle in many calcarea carp cases. See, this acute angle carry. Now, blue sclera seen in many calcarea carp. See, blue sclera. This is normal sclera, this is blue sclera. This is clinical observation in many calcarea carp cases. Till now, I have completed calcarea carp and bacillin. Now we'll move to calcarea fos. Now calcarea fos is pseudosodic. They are worse by cold. They are especially dry cold. Mental or physical better by rest and warmth. This is very important. Rest and warmth. Children are slow in learning to walk. Calcarea carp and silica. Delayed milestone like dentition, walking, delayed closing of sutures, history of rickets. I have a case of calcarea fos of recurrent conversion. I think it is there or not. Let's see. अगर मुझे मिलता है तो बताता हूँ. थोड़ा टाइम लगेगा. Now this small girl of almost 2 to 3 years of age came for the recurrent epileptic attacks. And it was treated very well with calcarea fos. I'm not able to open it. So let's move further.
Sir, what you said, recurrent?
Recurrent convulsions. बार बार उसको खींच आती थी. हाँ ये रहा. हाँ. Just listen what this mother is saying. It was most difficult case for me. Very difficult case. But this understanding of miasm helped me actually. So understanding of miasms are very important. Superb case. I was so lucky to use this remedy, calcarea fos. It is not opening. अगर आपका real understanding if you have about calcarea, many case you will solve. Open होगा तो मैं I'll share it up once again. Slow in learning to walk, delayed milestone, weak और curvature bone, bow legs आपको काफी केसेस में मिलेगा, काफी केसेस, knock knees, many cases. Then desire for meat, salt and eggs, very important of Megcar and calcarea foss. Ailment from grief, love, disappointment. Involuntary sign, ignitia, calcarea foss lachesis. Pain in abdomen soon after eating. Constitution which are lean, thin and narrow. Very tall for the age. Creosote, phosphorus, calcarea carb and sometimes calcarea carb also. Allen skin or calcarea carb. Now inverted triangle shape in calcarea foss. This is calcarea foss. Long, elongated, slender, thin fingers of calcarea foss cases. You will see in many calcarea foss cases. Curvature of bone or bow leg and knock knee seen in calcarea foss or the pseudosauric cases. Till now I have covered basilinum, then calcarea carb, calcarea foss, and now very interesting remedy is graphitis. How to see graphitis in clinical cases. Graphitis is psychosoric medicine with taint of syphilis. Why syphilis? Because there is ulceration, you will see. Ulceration with salivation. There are salivation with clean tongue. Very important in graphitis cases. Salivation with clean tongue. Backache with leukorrhea while passing stool. Mark weakness during menses. Tendency to suppuration. Burning sensation in head. The graphitis patient has chronic overgrown pulsatilla. Very important. Chronic overgrown pulsatilla. Pulsatilla is worse after milk, while graphitis is better after hot milk. Rather hot milk. Hot milk. Piles or burning pain in angles, worse sitting. Very important. Worse sitting. You can go to Fatak's Materia Medica. Fatak. Eyes. Sitting. See, are you able to see? Say yes.
Yes, sir.
See. So many cases you will solve by these three drugs. Worse sitting, causticum, graphitis, and thuja. Fatak, piles, aggravation sitting with graphitis symptom, causticum symptom, and thuja symptom. I will show you observation of graphitis cases. How to observe graphitis in clinical practice. ये slide आ गया ना? Okay. Medicine of great aversion. Aversion to meat. Desire for chicken. Very important. Chicken. Chicken you will get. Fried chicken you will get in calcarea foss. Calcarea foss. Fried chicken. Fried chicken. Fried things. Fried egg. Fried egg you will see it in natrum foss. So natrum foss, if you want to see natrum foss, Let's go to natrum phos. So natrum phos we desire fried eggs, or you can say omelette.
Nani?
Right? Are you able to see? Desire egg fried. Natrum
Yes.
phos, silica and natrum phos. Silica and natrum phos. LSD is also nice remedy. We are not using it, but do use this remedy. Natrum phos and silica and Taxus baccata, Coniferaceae family. See, you will get hemamelis also. Hemamelis, natrum phos and silica in fried eggs, or you can put it in omelette. Omelette disarmament, natrum phos, silica and hemamelis. Cook food, salt, sweet, hot drink, and caution. A constitution fatty, chilly and constipated. Tendency to thickness, tendency to catch cold, skin fold, sorinum and lycopodium, mucocutaneous, nitric acid, muriatic and condurango, lesion crack, glutinous discharge, alopecia areata, skin folds, very important. Thick yellow staining is mercury and selenium. Graphitic is heart cystic. Complaint run from right to left. Vertigo, pain in neck, looking upward. Bending head backward, suffocation during sleep. These are very important of graphitis. Graphitis is a polycrest remedy. Skin folds are very important in graphitis cases. These are the clinical observation. Ulcer with salivation seen in graphitis cases. This is ulcer and salivation. Now, ulcerated nostrils. This child doesn't have ulcerated nostril, but you will have ulcerated nostrils with salivation in graphitis cases. Cystic swelling of upper lid seen in many graphitis cases. Till now we have covered basilinum, then basilinum in palmistry, spina bifida, isolated alopecia areata spot, calcarea carb, psychosoric, gap between the teeth, very important. Sweat on the forehead, very important. Acute carrying angle, very important in calcarea carb cases. Blue sclera is very important in calcarea carb cases. Calcarea phos and inverted triangle face in calcarea phos cases. Long, slender, thin fingers in calcarea phos cases. Curvature of bow leg in calcarea phos cases. Graphitis psychosoric with syphilitic taint. Piles, skin fold, ulcer. Can anyone tell me the mind symptom of graphitis? What is the mind symptom of graphitis? Let's interact because we have still one
Very
and a
aware is in money matters. Graphitis.
half. Yes, once very
Very
aware.
aware is in money matters, sir.
Good,
Graphitis.
good,
Like
good.
arsenic.
Okay, good. I'll show you one very important mind symptom for nerve nurse repertory of graphitis. Let's open NER repertory. Let's go to NER. Mind graphitis. क्या बोल रहे हैं? Didn't hear. अच्छा. This is very important mind symptom in nerve repertory for graphitis. Are you able to see?
Yes, sir.
Mind addressed hates to be. The only remedy is graphitis. When the patient is addressed, for example, Karya sahab aa jao, once Nolia, please come. Rajesh, please come. Hates to be addressed in particular way. This is very, very important in graphitis case. This mind symptom is given only in nurse repertory. So let's go to now the next remedy is tuberculum. What a remedy and what a result. You won't practice properly without knowing tuberculum. Tuberculum is great pseudosoric remedy. Great pseudosoric remedy. They have shiny nails. This is very important in tuberculum cases. Shiny nails. Shiny nails you will get in also in silica cases, phosphorus cases, and white spot in nails, acid nitric sepia silica cases. They have tapering pointed nails. Cold clammy sweats on palm. Very chilly. Marked tendency to cold frequently. Chilly patient with desire for cold things. Silica. This is important slide of tuberculin. Cosmopolitan, also calcarea phos up to lesser degree. Fear of animal, especially black dog. Black dog is green. Black crow पता है? Dream of black crow. Black crow किसको पता है? Okay. Desire for sweet and cold things. Cold milk is very important. Exudative features are important. Raised ESR levels, very, very important. Tuberculinum, Drosera, VAB, and Ibukinum. Next session would be also on OA Julian cases. OA Julian. Raise ESR level. Now, this is a case which I was not able to show. Just have a look. Calcarea phos and tuberculin. Most difficult cases solved with tuberculum and calcarea phos. And this child used to have almost 10 to 12 episodes of convulsion. Very difficult it was. Treated with tuberculum followed by calcarea phos. Now, very important remedy is puja. Puja is psychosoric medicine, left-sided remedy. Rough, rigid, brittle nails, very important of puja cases. Pain in heels and soles. Heels and soles, excellent remedy is Chromicum. Let's go to Chromicum. So please open Chromicum from Borix Matermedica. Please open your Chromicum. आजकल heel pain have increased like anything. People are coming for heel pain only. There are many reels have been made on heel pain. See, we'll read the whole chapter of Chromicum. Pain flies rapidly from one place to another. Kali self and pulsatilla. Wandering pain along the bone. Worse cold. Left-sided sciatica, better motion. Bone feels sore and bruised. Very weak. Tearing pain in tibia. Syphilitic rheumatism. Mesarium. Pain and swelling, stiffness and crackling in all joints like natrum foss. Soreness of heels when walking. Very important. Tendo is swollen and painful. Give Chromicum in little higher potency. Pain in small spot, oxalic acid. Ignition. Soreness of heel when walking. Tendo is swollen and painful. Pains in small spot, oxalic acid. Bad effects of vaccination, entim-tard, mesarium, silica, thick and thin nails, growth of hairs on unusual part, face and upper lip, very important of puja cases, especially oleum decoris. Oleum decoris, you will get result mostly in 6C power. Intolerance and aversion to onion is seen in psychotic cases. Tooth decay at root while crown remains intact. Dream of falling from height. You will see from many cases of digitalis. Digitalis you will get from Kent. Kent has given very nice lecture on digitalis. Digitalis is a single mother syndrome, digitalis, which Dr. Sarkar has told. So let's go to Kent digitalis. Kent lectures digitalis. See, all cases of prostate gland, I do not know what I would do without digitalis. What a sentence Master Kant has given. In old cases of enlarged prostate gland, I do not know what I would do without digitalis. Then there is fear of suffocation. Fear of suffocation at night is from this origin. See, dream of falling. See, dream. Are you able to see dream of falling in digitalis? Say yes or no. Dream of falling, Kent, lectures, digitalis. And
Yes,
the
sir.
first two sentence of digitalis, superb sentence. See, क्या लिखा है? This drug was used by old school has done more mischief than any one drug in materia medica. Every patient who has fast heart or anything the matter with heart was given digitalis. It has caused more death than any other drug. My God. If administered when the heart is going fast, it will soon produce peculiar kind of paralysis. The heart that having lost its balance will compensation gives out. The patient sinks and finally dies. They do not know how many patients would have lived through fevers, pneumonia, and other acute disease. It is not being this remedy used as they use in tincture in many drops and doses until the heart was so down. This calls it sedative. Yes, it is a sedative. It makes patient very sedated. You have seen very sedated patient looks being in the hand of undertaker. This is what digitalis does. In this way, the sedative in the hands of allopath. A homeopathic physician never prescribed to bring down the pulse. He prescribes the patient and the heart action takes care of it. क्या लिखा है? Digitalis is very poor fever medicine. Instead of being when the pulse is fast, the proving says it is indicated when the pulse is slow, like Almir. So let's come to Thuja. Thuja has dream from dead person, waking, sleep with startles. Startles like silica. Piles and anal fissure of any rectal pathology, severe constipation or morning diarrhea. Any isolated abnormal growth, spots and mold, especially red. Leukorrhea at present, case of past history of any pelvic inflammatory disease suppressed. Hypopigmented spots, very important. Here and there. Puja, sepia, natrumsal. Increased frequency of urination. Increased frequency of urination, we have Medorinum. So let's go to Medorinum, Kent. Let's open Kent from Medorinum. Please open your Kent, Medorinum. Medorinum, Kent. Kent lectures, Medorinum, and you have to type polyuria. POLU. Polyuria. Fear of falling is there in Medorinum. See, are you able to see? View. कोई हाँ ना भी नहीं, आज सब सो गए क्या?
Yes, sir.
नहीं सर,
नहीं
यस
सर,
सर,
समझ नहीं देख रहे सर.
हम भी ढूंढ रहे हैं सर इधर.
हम भी ढूंढ रहे. गुड. सी, मेडोराइनम का देखो आप. In the above condition, medorinum will act promptly if there has been gonorrhea history, inflammation of blood bladder, prostate gland, or kidney, copious mucus urine, renal colic, parenchymal inflammation of kidney, copious pale urine, frequent urination at night, n number of hundred of cases you will get frequent urination at night, loss of urine in bed, inactivity of bladder and feeble stream of urine. It has cured cases of polio. Cured लिख रहा है. Next session will be on Kent's lecture and Kent's lesser writing. Be ready for this Kent. Chronic pain in ovarian region, sterility, psychotic sterility. Let's open Allen's keynote Meadowrand. Allen's keynote Meadowrand. Allen's keynote Meadowrand. See क्या लिखा है. For constitutional effect of mild treated suppressed gonorrhea, when the best selected remedy fails to lead or permanently improve. Person suffering from gout, rheumatism, neuralgia, and disease of spinal cord, picric acid. It membrane, even organic lesion ending in paralysis, which can be traced to a psychotic origin. For women with chronic ovaritis, J.H. Allen has given too much about Medoran. Pelvic cellulitis, fibroid cyst, morbid growth of uterus and ovaries, especially if symptom points to malignancy. With or without psychotic origin. With or without, very important. It may not be a psychotic origin. For serous or cancer or carcinoma or cancer, either acute or chronic in development, when the symptoms corresponds with the history of psychosis can be stressed, bear the same relation in deep-seated psychotic chronic affection of spine, sympathetic nervous system that Soranum does to deep-seated affection of skin and mucous membrane. My God. Children pale, rachitic, dwarf, stunted in growth, barataka, mentally dull and weak, great heat and soreness and enlargement of lymphatic gland all over body. Pain in arthritic, rheumatic, sequelae of suppressed gonorrhea, Daphna odorata, clematis, dilating the whole body, cactus, sore over, as if bruise, arnica and pituitary, trembling all over, intense nervous and profound exhaustion, state of collapse, wants to fan all the time, craves fresh air, skin yet throws of covers like lycopodium, cold and bath with cold perspiration, veritrum, weakness of mind, cannot remember things like chlorum, words or initial letters, has xerophilum, no? Initial letters, asks names for its most intimate friend, even forgets his own name, cannot spell correctly, wonders how a known name is spelled, constantly lose thread of conversation, that is anacardium. Great difficulty in stating a symptom, question has to repeat, has to lose herself, cannot speak without weeping, like sepia and many other. Anticipate dates, always anticipation, feels matters more sensitive before they occur and generally correct. Irritates at trifle, caused during the day, exhilarated at night. This is very important. Exhilarated at night. We have Meadorhinum and Calcarea floor. Very impatient and peevish. Anxiety nervous, extremely sensitive, starts at least sound. Time pass too slowly. Alumina, argentum, and cannabis indicate. It is great hurry when doing anything. In such a hurry, she fatigues. Many symptoms are aggravated when thinking. Pain return as soon he thinks about them oxalic acid. This is the remedy jam in our clinical practice. If you read it slowly and compare with other remedies, you will get excellent results. Head and diarrhea from jarring of cars. Loves driving, you know which is the remedy? Loves driving. Love driving.
Nitric acid.
The remedy is nitric acid. Driving. They love driving. Nitric acid.
Headache emulated by
Hmm.
driving.
Headache is emulated by driving. Very important of acid nitric. But we should have all the symptoms of nitric acid. Anxiety, bad driving out from. Driving place to place. Cautious driving his cars. Okay, let's move to Tuja again. So Tuja, कहाँ पे थे? Constitution of flabby hydrogenate sensitive to damp, bathing, getting wet, greasy, shiny face, acquired psychosis. So now let's move to Kali bichromicum. Now Kali bichromicum, I'll show you many cases on observation. How to observe Kali bic in cases. So Kali bichromicum is a multi-miasmatic remedy with dominant pseudosoric remedy. Crave for acid. Migraine with blurred vision, like cyclone. Periodic neuralgias are important. Deep punch out ulcer is very important. Deep punch out ulcers. Fatty chubby short neck is the entry point in many of Kali bichromicum cases. Person disposed to catch cold and sweating. Discharge are thick, stringy, and yellow. Pain in small spot. Oxalic ignitia calibrate. Catar with pain in root of nose like sticta. Sticta has lot of talking. Talking is there or loquacity. Sticta. So let's go to sticta then. So please open sticta. Sticta boric. Sticta pulmonaris boric. Borix metramedica. Patient must talk. Now let's read sticta. Offer a set of symptoms like coryza, bronchial catarrh, influenza, together with nervous rheumatic distress. There's great feeling of dullness and malaise as when the cold is coming on. This is very important. Dull pressure in forehead, rheumatic stiffness of neck. Why I'm stressing? Because we are sleeping under the AC and we have lot of rheumatic stiffness. AC sleeping, we have calcarea phos, osticum, even sticta. Mind feel as if floating in air like dhatura, lack and confusion of ideas. Patient must talk. Very important. Dull headache, dull heavy pressure in forehead and root of nose. Catarrhal headache before discharge appears. Feeling of fullness at root of nose. Nux vomica. Dryness of mucous membrane. Constant need to blow the nose, but no discharge. Incessant sneezing. Scanty flow of milk. Worse towards evening when tired. Housemaid knee. Housemaid knee, we have slag. Very nice remedy. Slag. And slag has lot of itching problem. Now, what is the aggravation? Sudden change of temperature, like sepia. Sepia, you can write sepia there. sepia. Now let's go to Calibichromicum. Calibichromicum boring. Calibichromicum has special affinity of the drug on the mucous membrane of stomach, bowel, and air spaces, bones and fibrous tissue. Cirrhosis of liver. Early cirrhosis, we have Senecio aureus and Mug dulcus, cirrhosis of liver. Plenty of cases you will get of cirrhosis of liver. Absence and anemia and absence of fever are characteristic. General weakness bordering on paralysis. It is especially indicated in fatty, fleshy, subject to catarrh, syphilitic, scrofulous history. Pains migrate quickly. I'd like to show you the ulcer of Calibichromicum. See, ulcer which punch out is very important. With tendency to penetrate and tenacious. I forget to put a case of CA of oral mucosa treated with Calibichromicum. Completely cured case of Calibichromicum with this indication, ulcer with punch out edge, with tendency to penetrate and tenacious exudation. Better by heat, worse beer, morning, hot weather. Hot weather. Kali Beach, Ellensky knot. Complaints occurring in hot weather. This is very important. Sexual desire absent in fleshy persons. Sexual desire absent in fleshy person in Ellensky. See, prolapse uterus seemingly in hot weather. Very important of Ellensky. Prolapse uterus seemingly in hot weather. Deep eating ulcer, often syphilitic. Edematous bladder like appearance of uvula. I'll show you the case of this Kalibich. Neuralgia at every hours and same hour, like China self. So again, let's go to sweat on the upper lip. This is very important again. Kalibich. Tongue is cracked, ulcer irregular margin, oral aphthous, red and suppurative. Sweat is sticky and cold. Cough, especially cold winter season. Pain in abdomen after eating. Loss of libido, flexion of knee, sciatica pain, heel pain, swelling of tendo-Achilles. Aggravation, cold, early morning, sitting, ambulation, heat. Yellow sclera, very important of, very important of Calibach. Blue sclera is calcarea cow. Blue sclera. Look it up. Now, yellow posterior coated tongue, ropey saliva, and swollen uvula in Calibach cases. This is very important. Now comes thyroidinum. What a remedy, thyroidinum. You can't practice of when you don't know use of thyroidinum. Thyroidinum is multi-miasmatic remedies, dominant psychosis. Gynecomastia can be solved with thyroidinum. It is combination of calcarea carb, natramure, sepia, and sulfur cases. The palms are warm and moist. Most patients are methodical and systematic like arsenic. Mostly indicated in hypersecretion of endocrine glands. Very chilly and very hot. Both you will get. Both you will get. Great hunger with weakness yet loses flesh. Intense desire for sweet. And sweet relieves them. Fatak, if you want to open, you can open Fatak. Let's open Fatak. Let's go to Fatak.
Sir, also great varieties of mixtures of allergies, sir.
Yeah.
Allergies.
Everything is, all kind of allergies you will get in thyroid in our cases. Allergic reactions, allergic skin, allergic rhinitis, allergic urticarias, hypertrophy of, this is very important, hypertrophy of interior nasal turbinate. This I have seen in many of my thyroidinum cases. Please take this slide as an important slide. It is specific action on abnormal hairy growth. Personal history of undescended testes, like aurum we have. And you will get history of eclampsia hyperemesis gravidorum. Patient with who are oversensitive. Now, one of my case with bilateral symmetrical skin eruptions. Are you able to see? See, inferior turbinate X-ray seen in thyroidinum cases. This is turbinate. This is enlarged turbinate. Mark emaciation you will see in thyroidinum cases. Now, what a remedy is Calcarea arsenicum? What a remedy is Calcarea arsenicum? It is a mixed miasm cases. You will be treating with Calcarea ars. It has multi-system involvement like liver, cardiac, spleen, pancreas, kidney, blood. They are mostly chilly patients. They crave alcohol. They are left-sided like lechosis cases. It is an organ remedy for brain tumors. Prasanto Banerjee uses in brain tumors. Epilepsy with heart disease, very thirsty for cold water. Best remedy for splenomegaly with low platelet count. Mostly patients are obese. Sweaty menopausal female with palpitation. Fear of heart disease, palpitation is Mimosa pudica. You know what is Mimosa pudica? Mimosa pudica. Very nice remedy it is, Mimosa. Let's go to Mimosa. Mimosa pudica. I'll show you Mimosa pudica, how it looks.
Touch me not plant.
Yes, touch me not plant. This is Mimosa pudica. See? Mimosa pudica. This is the plant. Activity, desire for exercise, physical. Ailment from anticipation will get in many Mimosa pudica cases. Anxiety before menses. Success doubts for. Now in Mimosa pudica cases, attachment, strong, mild, mother-child relationship. Please understand this dynamic of Mimosa pudica cases. Attachment, strong, mother-child. Cheerful, gay, alternating with sadness. Want of confidence is well, self and about future. आजकल बहुत मिलेगा ये want of confidence. and there is lot of delusion of body parts enlarged. Fear of heart disease, of palpitation during. This is the only remedy, Mimosa pudica. Grief, ailment form separated from mother being. I like to show this rubric where fear of heart disease, of palpitation during. Let's go to, because it is a cured case of mind. So let's go to fear of heart disease, fear of heart disease, palpitation during. From reliable repertory, it is the only remedy. See, दिख रहा है screen?
नहीं सर.
My fear heart disease of palpitations during. Dear student and friend, if you have this symptom in the patient, think about Mimosa pudica. Very nice small drug, a rare drug, very nice drug. Again, I like to show you this symptom. Fear heart disease of palpitation during Mimosa pudica. Chest palpitation, fright, fear, aggravate heart disease of, this is leg caprin. Leg caprin means a goat's milk. Narcissist is also symptom of Mimosa pudica. Offended easily by small word is Mimosa pudica. Admonitions from, very important, of Mimosa pudica. Yielding disposition, सबकी बात में आ जाना, Mimosa pudica. Will loss of is Mimosa pudica. See if you type will loss of, or if you can type yielding disposition. सबकी बात में आ जाना, yield to the talks of others. You will see Mimosa pudica. If you open the Adonis, you will get this Mimosa. Yielding. The Mimosa patient yields to the wishes of others. They don't have their own wishes. I was able to see from reliable repertory Mimosa pudica. This is Mimosa pudica. These are the role of smaller remedies with a very good spectrum of betterment with these small remedies. Mimosa pudica. Okay, let's come to the original work. Okay. Calcarea cars is used for old toppers. This symptom you should have: burning, restlessness, anxiety, gastric after eating, drinking, of obesity, profuse sweating, timidity, fear of calcareous, rush of blood to head, headache not lain on. Very important remedy after conine in malignancy. Very important. Calcareous. They have aggravation from slight exertion and cold. इसमें मैंने desire नहीं लिखा. This calcarea they desire warm soup, SUPC, is very important in calcarea arsenic cases with fear of birds. With fear of birds is very important. There is a book, whole book on calcarea arsenic cases. You can ask me after this session. Calcarea ars. I will share this book by calcarea ars, of calcarea ars. Warm soup desire. So let's desire warm soup. See calcarea ars. Calcarea ars bryonia, Pundarango, Ferrum, Natrimur, Philodendron, and Streptococcus. Streptococcus also desires warm soup. Warm, hot and sour. Hot and sour is pavocrystasis. You know what is pavocrystasis? Who will tell me what is pavocrystasis?
So spelling.
Pavocrystasis. Pavocrystasis. Anyone online?
Peacock.
It is peacock, and it is being proved by Dr. Chetna Sukla from Mumbai. And she is a very close friend of mine. And she has proved many rare drugs. Peacock is one of them. Pavocrystasis. It is proved from the feather of peacock. And this peacock will crave warm soup, hot and sour soup. ना? अगर हम कॉलेज होटल में जाते हैं तो फर्स्ट क्या मांगते हैं? वार्म हॉट सॉर सूप. चाइनीज सूप पीते हैं ना, चाइनीज वार्म सूप. दिस इज पीकॉक. delusion peacock, he or she is. The remedies. delusion of peacock किस में आता है? अरे बाबा कोई बोलो. delusion of peacock. Delusion peacock. The remedy is hyacinth. See, दिख रहा है क्या आप लोग को?
Yes, sir.
See, delusion, hallucination, imagination, illusion, peacock, hyacinth and pavo. Delusion, imagination, peacock chasing, hyacinth. Delusion, imagination, peacocks frightening away, hyacinth. My God, driving peacocks, hyacinth. Because hyacinth is very jealous drug. उसको कोई ब्यूटीफुल दिखता है ना, उसको पसंद ही नहीं होता है. कोई ब्यूटीफुल मेरे से भी दिख सकता है. नाना पाटेकर पिक्चर, वेरी नाइस पिक्चर. नाना पाटेकर, हस्बैंड वाइफ जेलेसी. हायोसाइमस का पूरा पिक्चर नाना पाटेकर ने बनाया. हायोसाइमस. And if you want to read every little detail, you can read Soul of Remedies by Dr. Rajan Sankaran, Hyosamus. Very nice book. Books. Soul of Remedies. Soul of Remedies. Hyosamus. Hyosamus is a plant remedy, belongs to acute miasm, and it alights to belladonna, stramolene, and also veratrum and lysinum. The main feeling of hyosamus belongs to suddenly let down, disappointed, betrayed, deserted by the person on whom one is completely dependent. My God, very important remedy. This situation cause in the patient acute fear and panic. It is cause of variety of reactions. One hand attractive, loquacity, jesting, sexuality, and other hand is threatening. One time loquacity, other hand is threatening. This is very important of Alzheimer's cases. Trembling, fear of being alone, facing danger and outside world by all by oneself. Acuteness of feeling create kind of insanity and foolish. Attracts attention by foolish behavior. This is very important. Very, very important. Attracts, tries to attract attention by foolish behavior. Behavior so ridicule that it provokes laughter. Ha ha ha. मजा आती है उसको ऐसा क्रैक जोक्स करने. Like other remedy, acute miasm, hyoscyamus is excitable. Symptoms appears and disappears suddenly. Situation of hyoscyamus is main deeply of a man deeply in love with his wife who is having extramarital affairs. Nana Patekar situation. I don't know the name of the film or movie, but it was a good movie to see of hyoscyamus. He is afraid that she will leave him and that he will be left all alone. He also feels threatened by her. She might try to poison him or do him some harm in order to try to get away. ये आजकल बहुत दिखता है. I don't know why it is seen, but it is been seen in many of my cases. But he loves her. He has to keep the relation going. He tries to attract her attention by joking, talking sexual behavior. At times he is suspicious and cautious because he feels threatened by her. He is also extremely jealous of other men. So he has also become angry and violent. All the time he feels that he is being wrong, that he is being persecuted. This may appear like lysine, but in later the feeling of persecution and violent reaction are episodic. In hyoscyamus, the feeling is very acute, intense reaction to suspicion, a foolish, excitable, open sexuality and violence. It may also appear like lachesis, but the lachesis is psychotic and is very clever and calculated, whereas hyoscyamus is acute and its reaction is ridiculous. It tries to attract attention by foolish behavior and antics and can also get threatening, violence, and striking. One of the main features of hyoscyamus could be feeling of sexuality unattractive. This is very important. Reaction to this open, shameless sexuality. This open, shameless sexuality exhibits a lewd sexual desire is overt, foolish way, lot of loud talks exposing genitalia is complementary to stephysagria, which is the picture of suppressed sexuality and aggressiveness, where hyoscyamus is the same open express. No wonder hyoscyamus has delusion. जो वापस आ रहा है, delusion seeing peacock. See, delusion seeing peacock, which are the most colorful and attractive birds. It is also has delusion of hand tied up in chain, which I understand feeling of facing acute threat. I have observed hyoscyamus patient to be loud and excitable and animated, like lachesis, loud speech. Slow speech is viola odorata, so that it may be mistaken for an animal remedy because it is in the subclass 6. They're quite suspicious, mistrustful, foolishly keeping asking physicians some question repeatedly, elicit laughter and make them appear ridiculous. Their talk may be naive and childish, at some time often shameless, and may reveal secret of intimate details about themselves to other. My God. They reveal secrets. Reveal secret in sleep is ammonium carb. Again, they are angry, complaining, threatening. When we see in certain cases of insanity which may need higher sense, inner threat of violence, a kind of suspiciousness which says, if you do anything to me, I will harm you. I have seen indicated in young person, especially girl, who due to conservative and strict upbringing are unable to express sexuality or sexual attractiveness. They feel forsaken and neglected. Suddenly, go out in insanity. They become openly shameless, talkative, and excited, a form of suspective, persecutory ideas. I have indicated in old men who lose their control become foolishly loquacious and shameless sexuality. This is very important in Alzheimer's cases. I had a patient who was scared of speaking on the stage, even though he was good at dancing. At first, it seems could be remedy for stage fright, but further question he said it has been dragged by 4% onto dance floor reaction, panic and fear, and going to be killed. This ISMS should be read in detail. See, these are the delusion, reveal secrets in sleep, reveals secrets, sleep. See, ammonium carb and arsenic. मिला देख रहे हो आप? Many ammoniums and arsenic will relieve secrets in sleep. Ammonium carb and arsenic reveal secret sleep in ammonium carb and arsenic. ISMS will release secrets like anything. Now, I think last remedy of the session is lachesis. Now, lachesis is multi-miasmatic remedy. Lachesis patients are basically hot patients with thirst. Yes. Oh, sorry. The last remedy of the session is lachesis. Now, lachesis is multi-miasmatic remedy. Lachesis patients are basically hot and thirsty. Lachesis cases are worse after sleep, early in the morning. Prostration in the morning, first line syphilis. Let's go to first line syphilis. Syphilanum boric. Let's open boric syphilanum. Please open syphilanum first line. What will I have? First line syphilanum boric. Utter frustration and debility in the morning. Please mark this because this will show you the syphilitic expression. Syphilis. How the syphilis will express. Shifting rheumatism, very important. Chronic eruption and rheumatism. मैं वापस रिपीट कर रहा हूं ये जनरल बोरिक में will give you the whole idea of syphilis, utter prostration and debility in the morning, shifting rheumatic pain, chronic eruption and rheumatism, ichthyosis, the fishy skin, syphilitic affection, pain from darkness to day-night, decrease and increase gradually, hereditary tendency to alcoholism, ulceration of mouth, nose, genital and skin, and succession of abscesses like Calcarea picricum. Calcarea picricum. So let's go again to lachesis. Great loquacity and shifting of ideas. Unfresh in sleep, dreams of snakes and dead body. Patient has deep sighing, throat faintness, scanty menses. Left palm is warmer than right. Lachesis is intolerant to sun, bad effect of jealousy, tongue trembling like cuprum. Left-sided complaint and right-sided sciatica. Patients are mostly thin, burning constriction, bluish discretion of the affected part. Psychotic tumor you will see in right-sided lachesis. This is taken from treasures of Dr. Praful Vijayakar. A case of lachesis will always be behind his mother, trying to find the environment in the room. Is the doctor dangerous? If the snake coming out of the hole, do survey. After next visit, he will sit down on the table directly on the and so sensitive and fearful. Lachesis later on become boss, hard on inferior, soft on superior, psychotic lachesis. This is the observation from Dr. Praful Vijay. Elongated tongue of lachesis. One of my lachesis cases. Are you able to see? Mind line is not there in this case. दिख रहा है आप लोग को? हाँ कि ना बोलना क्योंकि बहुत
Yes, sir.
इंपॉर्टेंट।
Yes, sir.
Yes,
Yes,
sir. Yes.
ये मेरा ही टेबल है और मैं यहीं प्रैक्टिस करता हूँ और यही पेशेंट है और लेक्सिस का है। इसमें ये देखो, ये हार्ट लाइन दिख रही है, माइंड लाइन है ही नहीं इसमें। और कौन सा हाथ है? लेफ्ट हाथ है। आप कुछ मत पूछो, अगर ये है, इफ इट इज देयर, डू प्रिस्क्राइब लेक्सिस। एंड दिस इज वीनस गर्डल. वीनस गर्डल इज फॉर लव मैरिज. This is venous girdle. Love marriage cases. Definitely you will get in many cases. Love marriage cases. Definitely. अगर मैं अभी पुणे था तो एक one of my friend asked me, patient doesn't speak. भले वो patient doesn't speak, the palmistry will speak. कुछ मत पूछो, एटलीस्ट हाथ देख लो उसका. Patient will tell you. If patient doesn't speak, just study his palmistry. Bifid tongue of lachesis. Black spot on tongue lachesis, psychotic lachesis. Now, the billionaire in the jet misses the old days. Millionaire misses to have a jet. Sports car wants to be a millionaire. Wishes for the sport car. A cyclist needs a job or car. Pedestrian wishes a bike. A paralyzed man just needs to walk again. Terminally ill patient needs to be healthy. There's always another level to chase. Standing you between happiness. Appreciate what you have. Matlab, you should appreciate what God has given to you. Spend your whole life changing what next. Never realize what someone else is dreaming. You already have. Happiness is not getting more. It is learning to be a grateful for what's already yours. Very important. So you should be grateful to what you are having till today. The attitude of gratitude. Many other books, understanding to come. And thank you for today. We have few minutes for question and answer. Please do ask. And thanks to Aurangabad team. Thanks to Pune team. Thanks to my all friends. And there are many books we can work on. I'm open to questioning for 10 minutes.
If anyone has questions, please ask.
Hello, sir.
Yes.
Next session will be palmistry.
No, it's
Palmistry
role of nosodes rather than palmistry.
is how you see the life. No, palmistry or
Palmistry is
astrology.
very difficult. Role of nosode is better or Kent lectures are better.
Kent lectures are superb.
Huh.
Lectures and even Kent's lesser writing. Nobody reads Kent's lesser writing.
Okay, huh. That's why if in 10th, 10 May is a Sunday next month.
Hmm.
So we will have a two sessions at May and June.
Okay.
At second Sunday, can it is possible?
Let me see my schedule, ma'am, because
Okay.
almost tighted schedule actually. I'm working now.
So according to your schedule, sir.
Yeah, I'll just let you know.
Huh? Huh.
But I am very sure about Kent lectures and Kent
Huh.
lesser writing.
Sir,
Yes, sir.
please for Kent lectures and research writings.
Yeah, definitely.
Huh?
You
Sure.
lock it that this will be the session. Next session will be on Kent lectures,
Huh.
Kent's lesser writing.
Okay, sir.
Definitely.
But please let us know the dates so we can have a before that we can have a publicity
Done,
accordingly.
done,
Huh?
done.
Huh.
Yeah.
Sir, just requesting you for the name of the book by J.H. Allen, Diseases of Skin, sir.
It is the same book, Disease of the Skin. You want to see the
That's it,
picture?
sir.
Yes. You want to
Okay,
see
okay.
the picture again?
Yes, sir, if you can.
Yeah. Why not? Just a minute. Just a minute.
Sir, will we get the recordings of this class, today's
Yeah, we are
class?
trying for that. We are trying. Definitely you will get it.
Thank you, sir.
See, this is the book.
Okay, sir.
Disease and Homeopathic Therapeutics of the Skin. Dear student and my friend, read this book because many skin problem will be solved by reading this book.
Thank you
Books are
so much,
our
sir.
friend. Yeah, thank you. My pleasure. Anytime, my pleasure.
Sir, it was a wonderful session.
Thank you.
I just want to know one aspect of it. Like
Uh,
when we were going through miasmatic rubrics, there
uh,
were hundreds of remedies, right?
uh.
How often in clinical practice it happens that a case demands some antisyphilitic medicine and sulfur comes up, and case demands some antipsychotic medicine and soranum comes up. So this myth is there, no, that soranum sulfur is antipsychotic. So how many times it happens that a specific anti-miasmatic is needed and a strong prominent medicine like sulfur will come up in antisyphilitic cases according to your experience, sir,
Uh,
if you can share.
See, if you read later part of Honeyman by Rima Handley, very nice book,
Yes, sir.
where she has put up that Dr. Honeyman used to prescribe sulfur as an antisoric to many of the cases. But mind that for to prescribe sulfur, you need some symptom of sulfur, at least minimum 3 symptom of sulfur or 3 symptom of soranum. If you read soranum from M.L. Tyler, last line, if you see, if you want, I can open my Tyler. Just let's see what is being written in soranum. So let's open M.L. Tyler, soranum. Soranum. Tyler drug picture, soranum. See what is being written. I think it is in the last line.
Sir, will you dish out the recordings on this platform? Where can we see the recordings whenever it comes?
You will see in Being Homeopath, which is my WhatsApp channel, and you will get it in YouTube also. We'll put it in a YouTube.
Yes, but how will we able to know, sir, that it's already been on YouTube?
Please share your number to us. We'll send it to you also personally.
Okay, in on this chart, I will be mentioning my number, sir. Is that okay?
It is okay. No
Thank you,
problem.
sir. Thank you.
See, Soranum should be based on the psoric symptom, and it is needed to complete the case in many of fever cases. What he writes in Tyler, I'm not getting at this moment. The answer to your question is you need some psoric symptom to close the cases, or intercurrent use of antipsoric. We need some antipsoric. We need some antipsychotic symptom for antipsychotic. It should not be the regular process that we should give to every patient antipsychotic, antipsoric, or antimiasmatic. When they are needed, you should give. That is the answer to your question. Better you go home and read Soranum from Tyler.
Sure, sir. I'll go through, sir. Thank you.
I got this actually. See,
Hello, sir.
what is being written. See,
जी मैं
what he has to say about the chronic miasm of Sora, which appears later on in our reproduction of this chronic disease. We have to read very clearly from Tyler Soran. Yeah, next question.
हेलो सर, मैं डॉक्टर अरमान पहली बार ज्वाइन कर रहा हूँ आपको।
हाँ जी,
मेरा
हाँ
एक क्वेश्चन ये मियाज्म को लेके ही है कि
जी।
जैसे क्रोनिक डिजीज जब पढ़ते हैं अपन, तो पेज
हाँ,
नंबर 35 में जैसे लिखा है,
हाँ,
सोरा इज दैट मोस्ट एशियंट मोस्ट यूनिवर्सल मोस्ट डिस्ट्रक्टिव, है ना?
हाँ,
तो ये जो वेनेरल डिजीजेस और नॉन वेनेरल डिजीजेस को लेके लिखा गया है, तो
हाँ,
अभी जैसे जब अपन रूब्रिक्स लेते हैं,
हम्म,
ठीक है, बात होती है सोरिक रूब्रिक, साइकोटिक रूब्रिक, सिफिलिटिक रूब्रिक्स, तो इसमें कैसे डिफरेंशिएट किया गया है, मतलब हैनीमैन की राइटिंग से, और अभी जो इस समय अपन लोग थ्योरीज पढ़ रहे हैं उसके।
जैसे आपका जो क्वेश्चन है भैया,
जी
हनीमन क्रॉनिक डिजीज में आप देखो कि लेटेंट सोरा के सिम्टम दिए हुए
जी जी
हैं।
जी
Hahnemann in chronic disease volume 2, the Hahnemann gives lot of latent psoric symptom. So you have to differentiate what is latent psoric symptom, what are secondary psychosis and tertiary psychosis. In our clinical understanding, we have to differentiate each rubric, which are psychotic rubric, which are psoric rubric, which are syphilitic rubric, which are tubercular rubric.
ओके
And
सर,
behind every rubric, anti-psoric or Sora is behind of everything because it is a mother miasm, according to Dr. Hahnemann. It took almost 12 years to understand the role of Sora. I gave you the story of Dr. AGD, right? AGD was traveling in one of the carriage. It is given in by Dr. Richard Hale, and he had known healing ulcer, and he wrote letter to Dr. Hahnemann. And he told that I am not getting relief in my eruption or in my healing of this ulcer. Hahnemann wrote, you need to take anti-psoric. And he was cured. And this Dr. AJD was converted to homeopathy. This is how our master used to give prescription. When it is needed, you should prescribe. And Sora is definitely destructive. More destructive is psychotic nowadays. The mind has become so psychotic. You should read Psychosis Volume 2 of J.H. Allen, this book. Wonderful book, wonderful book. For clinic or good physician who are not reading this book are failing in many of their cases. Definitely. Definitely you will fail without reading this book. Any other question? Let's call off the day and really love to answer your question. There are many answers being given in lesser writing Kent. Page, I think it is 200 in lesser writing Kent. Go home and read lesser writing Kent.
Yes, sir. We will definitely, and we
Lesser
will
writing.
have this lesser writing on May or June accordingly your schedule. Please let us know.
Yes, this is lesser. Superb book. And Gem has been given what is written after 30 years. He has given answer to potency. What was potency you should prescribe? Kent's lesser writing. वो भी मैं अभी करने वाला था, but we don't have time. Lesser writing Kent. Thank you, ma'am. Thank you so much. Thanks to
Thank
all.
you, sir. Thank you, everyone. Thank you, Karia,
Thank
sir. We are very lucky for this elaborative session, and we want to tie up with you for the next sessions and next sessions, so we can have the multiple knowledge
Thank you. Thank you.
by in every ways. Thank you so much.
Thank you.
Thank you,
It
Rajiv
is
sir.
the unending process of knowledge, and to gain a knowledge from you. You are a stalwart of homeopathy. So many things we have accumulated that we have done this mistake, or we have a thought of Kilcrephos, want to give the Kilcrephos, but just because of just because of lacunas in us, we can't give the right medicines. So by these sessions, everyone has that lesson, that think of these medicines and give it the medicines. Thank you so much, sir.
And please, can we create a WhatsApp group for all the participants?
Definitely, ma'am. Definitely.
Thank you, ma'am. Thank you so much.
Thank you.
Thank you, sir.
Thank you.
Thank you.
Vadode, sir, can you conclude? Bye.
Thank you so much, sir.
Thank you. Thank you, Rajesh.
हाँ सर, आपने हमको चांस दिया कि हम हमारे स्पीकर बने आप।
नहीं, my pleasure.
हम आप तो मैं आज का सेशन कंक्लूड करता हूँ सर। हेलो।
हाँ, thank you. Thank you.
थैंक यू सर, थैंक यू।
Thank you.